Every time you climb a staircase, stand up from a chair, or simply walk across a room, your knee cartilage absorbs a force equal to 4 times your entire body weight. It does this silently, without complaint, without asking for anything in return, for decades. But at some point after 40, something begins to shift. The morning stiffness that used to disappear in 5 minutes now takes an hour. The dull ache that only came after long walks now arrives after short ones. The clicking and grinding sound in your knee that you have been dismissing for 2 years is becoming impossible to ignore. Most people reach this point and are told the same things by their doctors. They are told that cartilage cannot regenerate, that the damage is permanent, that their choices are limited to anti-inflammatory medications, cortisone injections for short-term relief, and eventually a knee replacement surgery when the pain becomes unbearable. That information is outdated, and in many cases, it is simply wrong. The science of cartilage repair has changed significantly over the last decade. We now know that chondrocyte, the cells that build and maintain cartilage, remain active in adult joints well into old age. They can be stimulated. They can increase their production of collagen and proteoglycans. The damage that took years to accumulate can, with the right biological inputs, be meaningfully slowed, halted, and in early to moderate cases, partially reversed. Today on Health Say, we are going through 7 proven ways to restore knee cartilage after 40, with no surgery, no cortisone injections, and no waiting until a replacement becomes inevitable. Stay until the very last way. It carries the strongest clinical evidence of anything on this list, and almost no one outside of sports medicine clinics knows about it. To understand how to restore cartilage, you first need to understand what is actually happening inside your knee right now. Articular cartilage is the smooth, white tissue that covers the ends of your bones inside the joint. It has one primary function: to allow bones to glide against each other with almost zero friction while absorbing the shock of every step you take. Healthy cartilage is 4 to 6 millimeters thick at the knee. Under a microscope, it looks like a dense, organized network of collagen fibers embedded in a gel-like matrix of proteoglycans. It is one of the most mechanically sophisticated tissues in the human body. The cells responsible for maintaining all of this are called chondrocyte. They are the only cell type found inside cartilage, and their sole purpose is to produce and repair the surrounding matrix. The fundamental problem is that cartilage has no direct blood supply and no nerve supply of its own. It receives all of its nutrients, oxygen, glucose, growth factors, through a process called diffusion from the synovial fluid that fills the joint cavity. This means cartilage heals extraordinarily slowly. And under the wrong conditions, chronic inflammation, nutritional deficiency, mechanical overload, it does not heal at all. Osteoarthritis, the progressive degradation of knee cartilage, now affects over 500 million people worldwide. After 40, it becomes the leading cause of physical disability in adults globally. But every driver of this process can be addressed. That is exactly what we are about to do. Hydrolyzed collagen, the building material your cartilage is starving for. Cartilage is 60 to 70% collagen by dry weight. Type 2 collagen specifically forms the structural backbone of articular cartilage, the dense fiber network that holds everything together under load and gives cartilage its ability to resist compression. After the age of 40, collagen synthesis throughout the body declines by approximately 1% every year. This sounds negligible, but over a decade it represents a 10% reduction in the raw structural material your chondrocyte need to maintain and repair the cartilage matrix. The destruction rate stays constant. The rebuilding rate falls. The gap between the two is what we see on MRI as cartilage thinning. Hydrolyzed collagen peptides, collagen that has been broken into small, highly absorbable fragments, have been shown in multiple randomized controlled trials to reach the joint space and directly stimulate chondrocyte activity. A study published in the journal Osteoarthritis and Cartilage found that 10 grams of specific collagen peptides taken daily for 6 months produced significant improvements in knee joint pain and measurable increases in cartilage collagen synthesis markers in the blood, not just symptom relief, but evidence of actual repair activity. The mechanism works because chondrocytes detect collagen peptides in the bloodstream as a signal that collagen breakdown has occurred somewhere in the body. They respond by upregulating their own collagen production, precisely the biological response needed to rebuild what has been lost. Take 10 grams daily combined with vitamin C, which is an essential cofactor for collagen synthesis. Commit to at least 3 months before assessing results. Cartilage repair is a slow process, but under the right conditions, it is a real one. Movement as medicine. How the right exercise feeds your cartilage. Because cartilage has no blood supply, it depends entirely on movement to receive its nutrients. Every time you load and then unload your knee, every step, every bend, every squat, you are literally pumping nutrients from the surrounding synovial fluid into the cartilage matrix. This means that complete rest is one of the most damaging things you can do for already compromised cartilage. Inactivity starves chondrocyte of the glucose and growth factors they need to maintain and repair the matrix. Degradation accelerates. The tissue thins faster without mechanical stimulation than it does with the right kind of load. Swimming and water walking reduce joint load by up to 80% through buoyancy while maintaining full range of motion. Cycling preserves quadriceps strength and joint mobility with minimal impact. Flat walking with supportive footwear creates the ideal cyclical loading pattern for cartilage nutrition. Strengthening the muscles surrounding the knee is equally critical. Research shows that every kilogram of quadriceps muscle mass reduces the compressive load on the joint surface by approximately 4 kilograms with every step taken. Strong muscles are the shock absorbers that your cartilage desperately needs, and they can be built at any age. 20 to 30 minutes of low-impact movement every day, combined with targeted strength work 3 times per week, creates the mechanical environment in which cartilage can survive and begin to repair. Chronic low-grade inflammation is the invisible accelerant underneath cartilage breakdown. Inflammatory molecules called cytokines, particularly TNF-alpha and interleukin-1 beta, are directly toxic to chondrocyte. They suppress collagen and proteoglycan production. They activate enzymes called matrix metalloproteinases that literally dissolve the cartilage matrix from within. And they create a joint environment where biological repair is essentially impossible. The modern diet is a continuous generator of these cytokines. Refined carbohydrates, seed oils, processed sugar, and ultra-processed foods drive systemic inflammatory signaling that reaches every joint in your body with every meal. Omega-3 fatty acids from fatty fish, walnuts, and flaxseed are among the most evidence-supported natural inhibitors of cytokine production. A meta-analysis of 16 randomized controlled trials found that omega-3 supplementation at 2 to 3 grams of combined EPA and DHA daily significantly reduced knee pain scores and inflammatory blood markers in osteoarthritis patients. Curcumin, the active compound in turmeric, was shown in direct head-to-head trials to reduce knee pain and improve function with an effect size comparable to ibuprofen, without the gastrointestinal side effects associated with long-term NSAID use. To work, curcumin must always be taken with piperine from black pepper, which increases its bioavailability by up to 2,000%. A diet built around fatty fish, olive oil, leafy greens, and berries, and away from sugar, white flour, and processed foods, fundamentally changes the inflammatory chemistry inside your joints. It begins working within days of making the shift. Vitamin D, the hormone that directly controls cartilage cell survival. Vitamin D is not simply a bone nutrient. Chondrocyte and articular cartilage have vitamin D receptors directly on their surface, which means vitamin D is a direct regulator of cartilage cell function, proliferation, and the rate of collagen synthesis. Multiple large population studies have established a clear relationship between low vitamin D levels and both the prevalence and the rate of progression of knee osteoarthritis. In one study tracking cartilage volume on MRI over time, participants with vitamin D deficiency lost cartilage significantly faster than those with sufficient levels, independent of age, weight, and activity level. Vitamin K2 works alongside vitamin D by activating proteins that direct calcium into bone rather than into soft tissue calcifications that can accelerate joint degeneration. Have your 25-hydroxyvitamin D blood level tested. The optimal range for joint health is 40 to 60 nanograms per milliliter. The majority of adults in South Asia, particularly those who spend significant time indoors, test substantially below this level. Supplementation of 2,000 to 4,000 IU of vitamin D3 combined with 100 micrograms of K2 daily is the evidence-supported starting point for most deficient adults. Every kilogram lost removes 4 kilograms from your cartilage. For every kilogram of excess body weight carried, the compressive force on your knee cartilage increases by approximately 4 kilograms with every step taken on flat ground. During stair climbing, this multiplier rises to 7 or 8 kilograms of additional force per kilogram of body weight. During a single day of walking, your knees experience millions of these loading cycles. Research from the Framingham Osteoarthritis study found that even a modest weight reduction of 5 kilograms reduced the risk of developing symptomatic knee osteoarthritis by over 50% in overweight women. For people who already have cartilage damage, every kilogram lost translates into a measurable and immediate reduction in the destructive forces acting on the joint surface. Excess body fat is not merely a mechanical problem. Adipose tissue actively produces inflammatory cytokines, including leptin, that directly damage chondrocyte and accelerate matrix degradation. Excess weight functions simultaneously as a mechanical overload and a biochemical source of cartilage destruction, two separate pathways of damage operating at the same time, every day. Restore the fluid that lubricates and protects your joint. Inside your knee joint, articular cartilage surfaces are separated and lubricated by synovial fluid. This fluid is rich in hyaluronic acid, a large molecule that gives it the thick, viscous, shock-absorbing properties of egg white. It allows cartilage surfaces to glide against each other with a friction coefficient lower than any man-made lubricant ever engineered. In osteoarthritis, hyaluronic acid concentration in synovial fluid decreases significantly. The fluid becomes thin and watery. Its lubricating capacity drops. Friction between cartilage surfaces rises, where rate accelerates. Oral hyaluronic acid supplementation at 200 milligrams daily was shown in a randomized trial to measurably improve synovial fluid properties, knee pain, and functional outcomes over 12 months of use. Glucosamine sulfate provides the raw chemical building blocks for proteoglycan synthesis inside the cartilage matrix. At 1,500 milligrams daily, multiple trials have shown it slows the rate of joint space narrowing on X-ray, which is the standard radiological measure of cartilage thickness preservation, in patients with mild to moderate knee osteoarthritis. These two compounds address different aspects of the joint environment simultaneously. Hyaluronic acid restores the lubricating fluid. Glucosamine provides the raw material for cartilage matrix synthesis. Together, they create a more favorable environment for the repair processes driven by everything else on this list. This is the intervention that has transformed the conversation about non-surgical cartilage repair in the last 10 years. And it does not require a single cut. Platelet-rich plasma, PRP, is created from your own blood. A small sample is drawn and placed in a centrifuge which separates blood components by density. The platelet-rich layer is concentrated and injected directly into the knee joint under ultrasound guidance. Platelets are biological first responders that carry a powerful concentration of growth factors, including transforming growth factor beta, platelet-derived growth factor, and insulin-like growth factor 1. These growth factors directly stimulate chondrocyte to increase collagen and proteoglycan production. They suppress inflammatory cytokines in the joint space. They promote new blood vessel formation in the synovial tissue, improving the overall nutritional environment available to cartilage cells. A systematic review and meta-analysis published in the American Journal of Sports Medicine examined 47 randomized controlled trials of PRP for knee osteoarthritis. The conclusion was unambiguous. PRP produced significantly greater and more durable improvements in pain, function, and patient satisfaction compared to both hyaluronic acid injections and corticosteroids, and these benefits were maintained at 12-month follow-up. PRP is not experimental medicine. It is available at orthopedic and sports medicine clinics in most major cities. It requires no hospitalization, no general anesthesia, and no surgical recovery period. The procedure takes approximately 30 minutes from blood draw to injection. For adults over 40 with early to moderate knee cartilage damage, it represents the current gold standard of non-surgical cartilage repair. Here is your clear and immediate plan starting today. Begin hydrolyzed collagen at 10 grams every morning. Add it to tea, water, or any cold drink. It is completely tasteless and dissolves fully. Start vitamin C alongside it. Your chondrocyte will begin receiving the raw material they need within hours of your first dose. This week, add 20 minutes of low-impact movement every day without exception. Swimming, cycling, or flat walking. Remove sugar and refined carbohydrates from your daily diet as much as possible. Add fatty fish twice this week. These two changes alone will begin measurably reducing the inflammatory environment in your joints within days. This month, have your vitamin D level tested and start D3 with K2 supplementation. Add glucosamine sulfate at 1500 milligrams daily. If your knee pain is already disrupting your sleep or your ability to move normally, speak to a sports medicine or orthopedic specialist about PRP. Ask for it by name. You do not have to accept progressive joint destruction as an inevitable part of aging. Your knees have carried you your entire life. Through every step, every climb, every journey toward every person and place that has ever mattered to you. They have asked for nothing in return. Until now, the science is no longer ambiguous. Cartilage degradation is a biological process, and biological processes respond to the right inputs. 7 proven inputs that you can begin implementing today, without a surgeon, without a hospital, and without waiting until the damage is too far advanced to address. If this video gave you a path forward that your doctor has not discussed with you, share it with someone whose knees are holding them back from living the way they want to live. Leave a comment below and tell me which of these 7 ways you are starting today. I read every single one. I am Health Say. We visualize health. We think deeper. And we help you understand your body. See you in the next one.